Hello and welcome. My name is Dr. Rizwan Qureshi and I am a consultant in emergency medicine here in Sydney, Australia. Today I'm going to talk about my own specialty, the specialty that I fell in love with about 15 years ago. I've trained in it. I've worked as a consultant in this specialty now about 6 years and I absolutely love it. It's got its own advantages and its own disadvantages. Lots of people contact me asking about how do you get entry into the emergency training program, what's the work like in terms of training and also working as a consultant, how well does it pay, and what are the major advantages and disadvantages as I just said. Now first of all, what is an emergency medicine? As the name implies, it's a field of medicine which provides acute and emergency care to very sick patients. They might be trauma patients, cardiac arrest patients, or the patients who are just very sick. We look after everyone and anyone. Our workers are categorized as frontline workers. And we've gained a lot of respect from the community and public. Also, emergency medicine is one of those very heavily popularized in mainstream media. You may remember shows like ER, reality TV shows like 24 Hours in Emergency. And why is that? I think it's because of the fact that we provide acute care to stabilize a patient with mostly good outcomes. So it's a happy story, but there's a lot of emotional involved during that time. So it has got all the perfect recipe of having a challenging situation, stabilizing that, plus the emotion to cover all aspects from bad to improving to improvements. I think I belong to the third generation of emergency medicine specialists. The first gen were the people who were sent to these rooms and cubicles down in the hospital to stabilize very sick patients who were injured or who were just sick. They were not called emergency doctors at that time, but when they went there, they realized this is a complete science, the science of resuscitation, the science of patient flow management, and they improved the processes. They made a training process, they made the assessment process for the second generation of physician to go and improve it further. And us third generation have gone through that very robust training pathway. The emergency medicine training in Australia from next year, that is 2022, is again changing. It's now divided into 4 different stages. Each stage approximately lasts for about a year. The entry requirements into the emergency medicine training program involves that you must be fully registered, you must be PGY3 or above, you need to have structured references when starting the program. Once you are accepted onto a program, you can sit your primary exam, which is based on basic medical sciences, anatomy, physiology, pharmacology, and pathology, written, and the viva components. You then do 4 years of training, and plus at the end you do a fellowship exam, which is a combination of written and an OSCE. Now in those 4 years of training, it is a very structured process. You're meant to be doing 10 ITAs per year, which is in training assessment. Now these ITAs are a combination of CBDs, mini key access, TOPS, and these are college way of ensuring that you're progressing through your career satisfactorily instead of keeping tabs of you at the beginning, at the end. Also in that 4-year period, you're meant to be doing some critical care work, which means ICU and anesthesia, pediatric emergency medicine experience, and also other requirements as research requirements, clinical guidelines, morbidity and mortality work, and some sort of other administrating and ultrasound work depending on your interest. At the end, when you finish your program and pass your fellowship exam, you can then be eligible to apply for consultant position. Now all of the consultant positions are only open to ACEMs in Australia, meaning the people who have passed the fellowship exam. There are no self-structuring pathways to ACEM. There's only one pathway, which is through the structured training program. Once you've passed the fellowship exam, you can apply for 3 types of different consultant jobs. One is staff specialists, which are permanent contracts offered by the hospital or area health networks. Then there's VMO or visiting medical officer contract, which are based on hourly pay rate, and they are quinquennial, meaning 4 yearly contract. And then there's locum consultants, which are sort of ad hoc, done in different departments, different cities, which suit particular lives. Now, what's the work like in emergency department? On an average, the department sees between 200 to 250 patients per 24-hour period. When you're starting your shift, you're assigned to a team which is supervised by a consultant, may have an intern, resident registrar, and a casualty medical officer. You'll function as part of that team in a specified area. You might be working resus, acute, or fast track area. So you're very closely working with a team, and if you've got any queries, concern, you will feel that you're very well supported here, at least in Australia. On your average shift, you will see about 10 to 12 patients, sometimes even more if you're working in fast track area. You will be working alongside the nurses and allied healthcare staff, and you'll find that it is a very busy and a noisy place. Feel a part of a big team. The starting salary of a registrar is $80,000, which may progress on to become $120,000 by about year 5. It also loads up weekend work, out of hours work, evening shifts, night shifts, and public holidays. So take home salary might be more than $120,000 depending on how much shifts you're doing out of hours. For consultant, the starting salary is $200,000 and it may climb up to $450,000 for year 10 consultants. It also gives you 6 weeks paid annual leave for a full-time consultant. It gives you 2.5 weeks of education or TESOL leave plus sick leave. You also get paid 10% superannuation on top of your salary. The VMOs are paid at $250 per hour, but if you're not working, you're not getting paid. Also, it does not allow for any annual leave, sick leave, or any sort of education funding. So on an average, it equals out to the staff specialist salary at a junior level. Now, in terms of comparison to the other specialties like cardiology, orthopedics, general surgery, or some of the other medical subspecialties might be getting paid more because of their private practice. Now, because emergency medical specialists don't have private practice, they do get paid a private practice allowance and some other allowances on top of that. So if you're comparing between the two salaries, it's often very difficult to compare the two forms of pay structure, but on an average, for the amount of work that emergency physicians do, they are very well remunerated, and it does provide them with a good work-life balance. The future of emergency medicine is great, at least here in Australia. Most of the departments in the cities and the regional areas are expanding. Also, there's a lot of migration happening in the regional center, so these departments are also expanding. So if you've got a job in regional center, you'll work with a team of doctors who are young, energetic, and trying to reform their own places. Typically, emergency department in regional centers are now hiring more staff specialists, more registrars, more residents, and more interns. And they're attracting even IMGs to come and work in those areas. Also, there are opportunities to subspecialize when you're training. So you may like to subspecialize in toxicology or hyperbaric medicine. Sometimes you'd like to co-train with pediatrics and intensive care. So you may find your own niche. Also, there's a lot of collaboration in terms of courses, workshop, conferences. Everywhere in the world, every country have got their own emergency society. They hold conferences, organize workshops. You might be able to travel in the world and meet all your colleagues from different parts of the world. So overall, this branch of medicine is looking very promising from the growth perspective, from the job security perspective, and the expansion perspective, at least for the next 10-15 years. Top 5 pros, good and relatively easy specialty to enter into, especially for IMGs. If you're migrating from another country, you can start your work in emergency department. If you're interested in resuscitation and looking after the patients who are very unwell and critically unwell, then this is the specialty for you. If you like engaging with people, talking to patients and their relatives, if you've got that emotional connection, then you may find that emergency medicine has got a lot to offer. I don't think there's any other specialty which offers that up-close interaction with the patient and their relative when it comes to sick patients and their management. Also, the people who are fully qualified as FR Chem in the UK and in the US, they can come and work independently as a consultant here in Australia after some initial assessment. Top 5 disadvantages. So if you don't like shift work, then emergency medicine is not for you. The trainees mostly do a combination of day shift, evening shift, and night shift. The consultant do day shift and evening shifts. There are no night shifts as of yet for consultants working in Australia. Also, it is a service which is dependent hugely on resources within the hospital and outside the emergency department. So if you feel that the hospital system is clogged up, there are no access to the beds, and then your patients are piling up in the corridor, in the waiting room, then it can be very frustrating. In fact, it is one of the leading causes of burnout when you're not able to influence or change the system and your patient suffer consequently as a result of that. Emergency medicine can be a very emotional place, especially when you're dealing with unsuccessful outcome of resuscitation related to pediatrics. There's a lot of multi-system trauma, there's a lot of blood, there's a lot of procedures. And if you don't particularly like that nature of work in medicine, then emergency medicine would be not for you. Now, more and more jobs are drying up from the city, and more jobs are available in the regional and the rural centers because of the expansion and growth in those areas. You may find that you have to travel sometime to work, often an hour up to a couple of hours to get to your job, but just be prepared to go and work in the regional areas. Conclusion, at the end, for me, I like emergency medicine because it provides me not only saving patients' life who are very unwell, but I also like it because it provides me with an opportunity to engage with the patient's relative. Now, the relatives obviously feel very emotional when they have got a patient who is very sick, who's unstable, they don't know what's happening. And when I'm able to console them and explain it to them in a systematic way, in a very calm and collective way, they feel very reassured. And I think that aspect of care is very unique to emergency medicine. Also, the other aspect of emergency medicine that I enjoy is working with my junior doctors. When I'm working on the floor, I'm working with a team of interns, residents, registrar. We're all sitting together shoulder to shoulder. We go out, assess the patient, put in a cannula together, manage the patient together. If I'm able to teach them a skill or a procedure, I sometimes see sparkle in their eyes, that they've learned something new. They feel passionate about doing procedures, and it's very rewarding when you see that kind of feedback which is immediate from your residents and your junior doctors. You just feel it's all worth a while. If you like this video, please leave me a comment or a feedback. If you've got any questions, please leave a comment. Please also subscribe to our YouTube channel Emergency Focus, and I'll see you next time with a new video. Thank you very much.